we're going to focus on happiness, actually. So we're going to revisit that topic just a little bit in the context of contrasting happiness with what we're working with this week. Okay, so hopefully that will help to frame things for you in a way that will be helpful for you to engage with the practice more effectively this week. So this article here outlines a very specific definition of what happiness is, which I think is helpful. So that's what I'm going to work with tonight. And it's very similar to a lot of the other psychological studies that they've published. So happiness is basically defined in psychology as a subjective state of well-being. And it encompasses three main subjective states that we can think about. The first is affect. Okay, so affective well-being is what they call that. And this is the topic that our joy and our positive emotions, pleasurable experiences fall into. Okay, so joy would be part of what we would call a positive affect. All right, so joy in this sense can be a component of experiencing happiness or subjective well-being. Eudaimonic well-being is basically having a sense of meaning and purpose in the world, in your life. And evaluative well-being is life satisfaction. So let's look at those three things a little bit more closely. So if we look at affective well-being, this is experiencing positive feelings and mood states. Okay, so let's look at that a little bit more closely right now. A mood, they define often as a, well, let's talk about it this way. A feeling is a temporary state which usually is related to some kind of object. Okay, our relation with an objective experience. Whereas a mood, again, in psychological terms, a mood is a state which is more free floating. Okay, so it's not necessarily related to an object or a situation, and it's more sustained. Okay, so when we talk about positive affect, we would be talking about experience positive feelings, so fleeting experiences, or positive mood states, such as happiness, joy, elation, vitality, pleasure, and cheerfulness. And I made a note here, equanimity balances hedonism, because there's always a fine line between seeking out pleasurable experiences, right? And craving pleasurable experiences, which can be self-destructive, okay? So equanimity, which is what we will be talking about next week, balances any tendency we might be feeling towards craving, okay? So in affective well-being, if you're trying to achieve positive affect, there are basically two steps, which are logical. The first would be to decrease negative affect. So do things that combat depression, stress, anxiety, those kind of emotional experiences that we would call negative. Most of psychology for a long time had been focused on methods to decrease negative states. Now there's more interest in the positive psychology movement on how we can increase positive affect and improve our positive well-being and cultivate happiness. Okay, so this affective well-being is really what we're working with when we're doing our metta meditation, and specifically when we're working with the positive emotion of joy. Eudaimonic well-being involves judgments about the realization of personal potential and fulfillment of life goals. So remember, we're saying happiness is a subjective state, because happiness is actually a state that is governed by how we think about what is going on. Happiness is related to our relationship with ourself and our personal experiences and how those are affecting me, okay? And then how I'm thinking about those things. So aspects of evaluating meaning and purpose involve or are related to skills like flourishing, having a sense of autonomy, feeling that you're growing, okay, personal growth, environmental mastery, so having control over your environment, having positive relationships with other people, and self-acceptance. So the third category within the subjective well-being happiness framework is called evaluative well-being. And this is basically our judgment about the quality of our life and how good our life is. So you can see that when we hear people say things like happiness is a choice, okay, if we think about happiness in this context, understanding that it's really a subjective state, we can understand the truth of that statement. And we can also understand how it's possible for us to learn to be happier, because much of our experience of our degree of happiness has to do with the way that we're framing our experiences and how we're judging them. Okay. So now, let me see if there was something else I wanted to say here. Okay. There's a lot in my head around all of this stuff, and I really tried really hard to organize everything for you guys today because there's so many amazing things to talk about. So, this slide I put up here because when we're doing practices like this, or when you decide to do anything with the goal of being happier, okay, it's important to acknowledge the trap that we can fall into when we get attached to the results. Okay, and they do acknowledge this with a lot of these positive psychology studies and studies in psychology about increasing wellness and doing things to create a greater sense of happiness and well-being. So what happens when we do something, okay, like let's say we do this Metta Meditation Masterclass with the hope and dream that we will feel happier at the end of it. And what happens when we place a really high value on the end result of happiness, and then our experience does not match up with those expectations that we have? Can you guys see how that would be problematic? Okay. And it can actually work against our goal. So when we are taking an action towards a goal, the way to help yourself have a more effective experience, okay, is that once you've set your goal, okay, and you're traveling forward on a path, then you let go of your expectations around the end result. Okay. And this is a long and complex topic of exploration. regarding how does one do that. And it's something that you have to play with, because there's a fine balance between having a goal in mind so that you are motivated to move forward, and then creating space for you to experience the process, and actually to value the process more than you're valuing the goal that you're trying to reach. And this can be a really profound shift, especially for those of us that have very driven careers. Okay, so you go to college so that you can go to vet school, and then, you know, some of us went to vet school so then we can do a residency, and you're constantly looking forward to the next thing, okay, to the goal. And so we've conditioned ourselves for a long time to always be goal oriented or goal focused. And what that does is it conditions us to not be present with the journey in the same way, and to actually value the process of getting to the goal as the goal. Okay, so think about that for a little bit. And the reason that I'm bringing that up now is because we're all in different places, okay? And we all have different ideas about what happiness means for us, and whether we're happy or not, whether happiness is achievable, whether we believe it's achievable or not. And so I want you to just sort of think about your relationship with the idea of happiness, and be aware of the fact that in the end, whether you're happy or not is totally subjective. It is not, it is more based on how you're thinking about your experiences, okay, than the experiences themselves in a certain sense, which is why we can do things like learn how the mind works, learn how to reframe our circumstances, okay, learn how to work with our neurobiology in order to create greater states of happiness in situations where, in fact, maybe our external circumstances don't change that much, but we can then feel happy because we will have more, a higher state of subjective well-being because of the stories that we're telling ourselves. And this is where our mindset and our optimism, there are lots of studies about optimism and how those are related to happiness, and self-empowerment. Okay, so understanding that you have power to change your subjective experiences. Now I want to offer you some ideas related to how we can take what we're doing in our Metta Meditation Masterclass and apply it to our career. Okay, there's some really sweet articles recently on the, you know, on the topic of burnout, okay, that actually look at joy in clinical practice, bringing joy back to medicine. And most of these haven't really made it to veterinary medicine yet, but there are quite a lot of studies looking at joy in physician-based practices, and how to cultivate or rekindle joy for your work, okay, when you're in a medical setting. And this article, called An Organizational Framework to Reduce Professional Burnout and Bring Back Joy in Practice, doesn't that sound nice, defines joy as this: joy in practice is the aspirational state in which professionals are emotionally and behaviorally, compassionately engaged in the care of patients and the mission of their organization. And they say it this way specifically because in this article, they're acknowledging the fact that the culture of medicine has really changed a lot. And there is a very real impact that has happened as a result of medicine becoming like made into a business. Okay. And we can all relate to that, I think, especially if you own your own practice, right? So nobody really gets into medicine because they are thinking about the business part of it for the most part. We get into it because we have an intrinsic motivation to serve other people. And this is what I want to focus on for us this week. This is the difference between joy and happiness. Okay. Joy is about our relationship with the world around us, whereas happiness is about our relationship with ourself. Can you understand how that might be the case? So joy has a lot of, it is very entwined with our sense of purpose and our sense of meaning and our service to the world, how we're helping other people, how we're relating to our environment, the meaning that we have within that environment, and our relationships with other people. Okay. And this is a really important thing, I think, for a lot of us to think about in the context of our clinical practice, especially if we're in situations where we're feeling burned out, where we've lost the joy of our practice. And then we can look at, well, where does joy come from? Okay. And where did it go? And how do I get it back? Okay. Because joy is an internal emotion, okay, a feeling that can become a way of being in the world. We can grow that into a state of being joyful, okay? So in these articles about cultivating the joy of medicine, one of the things that they focus on is intrinsic motivators as a source of joy in our life and a source of joy in our work. And so what they recommend is that we focus on intrinsic motivators over extrinsic ones. Okay, so extrinsic motivators would be things like your paycheck. Okay. Intrinsic motivators would be things like, helping other people, feeling a sense of fulfillment. All right. And they focus on your individual internal views. Intrinsic motivators are unique to you. Okay. And while there are themes generally around what intrinsically motivates people in general, what intrinsically motivates you in your work and brings you joy in your work is going to be unique to you. And what they propose in these practices or organizational frameworks for supporting joy in medicine is to allow physicians, doctors, to engage with their practice in a way that brings them joy, okay, that fulfills these intrinsic motivators. And this can be a really powerful reflection to go through if you're feeling a decided lack of joyfulness in your work. And I think I described to you guys before, I went through basically a year where I said, okay, I'm not happy. So why am I not happy? What brings me joy? And what am I not doing that I could be doing? And how can I restructure the way that I'm engaging with my environment and with my work and with my meaning and purpose in a way that brings me joy again? Okay. And that's all our own responsibility. Okay. Only you can do that for yourself. And I would suggest that you might want to explore that if you're, feeling like that would be helpful to you, because it can be very transformative. So in particular, you would focus on things like how you view your work, how you seek enjoyment, how you stimulate your curiosity or your interest, what interests you. And then how you find reward within personal challenges you encounter. And this again goes back to our topic of mindset. Okay. Do you have a growth mindset in which when a challenge comes to you, you look at it as an opportunity to learn, an opportunity to get smarter, an opportunity to expand your capacity? Or do you have a fixed mindset where challenges feel threatening to you? Okay. And that is interestingly related to things that intrinsically motivate us. So what challenges make us feel like we have an opportunity for growth? Okay. And basically, when we focus on these intrinsic motivators, we have an increased sense of calling to our work. That's the long and short of it. That results in more resilience, less burnout, and more career satisfaction. Okay, so those are some things that you maybe can think about in your work. And this week, as we're diving into this topic of joy, joyful effort, and purpose and meaning and how we serve those around us, you can maybe even write things down that come to you in your journal. Okay. So they say that when they evaluate the impact of joy in medicine in particular, so we're still within this evaluation of bringing back a sense of meaning and purpose to our work as doctors. Okay, when that's been lost, when we're feeling burnt out. And remember, because we said burnout is characterized by a few things. One of the things is feeling like you're not effective. Okay. And losing connection with your sense of self, depersonalization. And so joy brings you back to who you are, why you're here, why you're doing what you're doing, and what brings you a sense of fulfillment. You can see how those are related. So joy is specifically grounded in relationships. So one of the things that we can think about cultivating or nurturing is our relationship with our patients, our relationship with our clients, our relationship with our colleagues, and our friends and family. Okay. Joy is also increased when we learn to live in the present moment. So those are going to be more mindfulness practices, which will be our next masterclass topic. When we approach our work with gratitude. So every Monday we have our Gratefulness Monday, right? And that helps us to focus on the things that we're grateful for in life. But also we can do that in our work. So what are you grateful for in your job? What are you grateful for in your career? What are you grateful for with your patients or your clients? And then because again, joy is related to how we are interacting with the world around us, then appreciating the privilege that we have to serve other beings brings joy. Okay. Because as we are in service to others, joy arises because we feel purposeful. We feel like we matter. Okay. And we see how our actions help other people. So this is joy. Can you begin to see how joy is different than happiness? Okay, does anybody have questions around that particular contrast before we go forward? Because I want to try to be really clear about that with you guys. No questions. Okay. So then they wrap up this whole joy in medicine topic by stating that choosing joy is an ongoing personal practice, okay? Because of all the things we just said. Every day you have to decide to choose joy. You have to decide to choose to focus on gratitude, decide to appreciate the gift of being able to offer something to other people, to be able to help them, to be able to offer a path to healing. And then while we take personal responsibility for our joy, for our interaction with the external world and how we're engaging with that, then we also think about the interaction of our personal effort and our environment, okay? Because that is a real thing. So you have to engage personal effort in order to sustain joy and to create meaning for yourself, okay? And then there is also a role within the organization, okay? So again, some of these studies are looking at hospital settings and things like that. And so they're talking about how do we create hospital environments that will support joy and flourishing, because it results in better patient care. It results in less medical mistakes. Okay. It helps doctors to think more clearly and to be creative. Okay, because of this broaden and build theory that we're going to talk about in a second. So if you, for example, own a clinic, or you work in a large hospital that is open to these ideas, okay, that is focused on supporting its employees, okay, then organizations can implement strategies to improve work and learning environments. For example, like I was starting to say before, they can support doctors in achieving a goodness of fit, they call it, in their career. So allowing them to practice in a way that aligns with their passions and values. All right.